Welcome to Health Connections on KCAT Television, Los Gatos, Montserrat. I'm Dr. Stuart Menakar from the Palo Alto Medical Foundation, Los Gatos Center. On today's program, we're going to be talking about healthy nutrition and weight management. I have two of my esteemed colleagues with me today, Seema Karnik, who is manager of our nutrition services, and Dr. Vivek Jain from our Department of Internal Medicine. Welcome to you both.
Thank you.
Thanks, Stuart.
Thanks for joining me. Vivek?
Pleasure.
Good to see you. Let's start with you, Seema. Please tell our viewers a little bit about, why is nutrition important to you? Why did you become a dietitian?
That's a very good question, Dr. Menakar, and thanks for having me and thanks for giving me an opportunity to explain my little background. I came here from India 32 years ago, and even as a child, I always wanted to talk to people all the time. And I always wanted to help, but then as I grew up, then I got more of a definition of what exactly I wanted to do. Well, I was also very much into wellness, and as we all know, wellness begins at home and particularly in your kitchen. So I started helping my mom in the kitchen, and that really brought my curiosity and interest in modifying recipes and making it better, at the same time tasty and healthy. So when I graduated from college, I chose to become a dietitian and did my postgraduate work in nutrition and dietetics. Then I came here. When I came here, people told me computers is the way to go. And so I did my MBA, but I knew for sure that I wanted to stay in healthcare. So I chose to pursue my education in dietetics, and I got my registration as a registered dietitian, and I started working. I enjoy every bit of it, and I'm able to take my kitchen to work and share all my ideas, my recipes, while making my patients more healthy and health conscious.
Well, and Vivek, I know that you and I both know in our primary care practices that the work that Seema and her team of dietitians and nutrition specialists do to help our patients is phenomenal. Actually, when I joined the Palo Alto Medical Foundation in the year 2000, I came from a group of doctors that was much larger than ours was at that time. And we also had nutrition and diabetes educators. And even in the smaller clinic here, Seema and her team did a much better job and still do. You guys are fabulous.
Thank you.
Well, so Vivek, I spoke for you, but I think you'll agree with
Yes,
all of that.
I will, yeah.
Please tell us, if you would, a little bit about yourself and what's an internal medicine doctor and why is nutrition and weight management important to you and your patients?
Absolutely. First of all, I will take off from where you said, Stuart, about Seema and her team. I think it's been a pleasure to work with them. Our patients have really appreciated it, and as have all of us doctors, certainly. As you mentioned, I'm an internal medicine doctor. That means that I take care of primarily adult patients, from easier, milder issues to very complicated issues. I knew I wanted to be a doctor quite early. And I would say probably in 8th, 9th grade or so, I was having leanings towards science anyway, and I really wanted to help people, and I found no better calling than the medical field. I went to the East Coast for my undergrad. I made that mistake and came back right away to the West Coast for my medical school and residency. So I'm pretty much a West Coast boy. But as I got on into my medical training, I realized and understood how important nutrition and a healthy lifestyle is to keeping our patients healthy. Part of what I do as an internist is prevention. And I would say that if we can prevent something from happening, it's much better than having to treat it with medicines and other things thereafter. So I really like to get to the root of it, try to prevent it from happening, and I think that people will be much healthier that way.
We've talked on a lot of our Health Connections episodes about the importance of prevention for all kinds of illnesses. Maybe before we talk a little bit more about specifically what eating healthily means, you could tell us a little bit about what kinds of medical problems we can prevent by having healthy nutrition and weight.
That's an excellent question, Stuart. Thanks for asking that. I think that pretty much all medical conditions that we deal with nowadays have some level of rooting in our diet and in our lifestyle. The most prominent of these that we see very frequently as internal medicine and family practitioners would be high blood pressure, would be diabetes, high cholesterol, and ultimately many of these feed into the number one killer in the world, which is coronary artery disease or heart disease. So I would say that although nutrition has an overarching effect on all aspects of our health, these three is what I would say would be the most important for now.
And all of those can be helped with a healthy diet.
Absolutely.
So let's talk about it, Seema. How should we eat to be healthy?
That's an excellent question, and the answer could be very broad, but I'll try to keep it as simple as I can. A healthy diet to me is what works for an individual. I usually start off telling patients is there is one thing as what you need to do, and there is another thing is what you can do. So we like to bring patients from where they are to where they need to go, and it's a slow process. So healthy diet is not just one diet, but it's a process where people need to look at what they're eating at home or if they're eating outside very frequently, which is a very common phenomenon these days with both parents working long hours. Home cooked meals is becoming more and more rare. So they are depending on dining out, takeouts. They are depending on some goods delivery services, such as there are a couple of them in the Bay Area, which Manchuri and Blue Apron. So there are various choices that they have. To pinpoint a healthy diet is as simple as telling to have lean proteins, have fruits and vegetables. If you're eating too many grains, change them to whole grains and certainly reduce the amount of grains in your diet. So basically looking at what you're doing now and then changing what works for you is my way of working with a healthy diet. Because I can tell patient to do 1, 2, 3, 4 things, but they can only do 2 things, and that is a progress for them. And I believe that we, as healthcare providers, we, as dietitians, we tend to be more patient with them and make them realize what works best, what is easy to change at this point, and then slowly work on that process. So to answer your question, healthy diet is ideally fruits, vegetables, lean meats, lean proteins. Doesn't matter whether you're vegetarian or not vegetarian, you still have plenty of choices, but certainly taking our focus from grains to greens.
And I just want to mention to our viewers that when Seema and Vivek and I are talking about diet, we're using it in the global sense, not about I need to go on a diet to lose weight, but about everything we eat is part of our diet. In fact, when I speak to patients in my medical practice, I like to recommend that we work on what is a good healthy diet to eat all the time, whether we need to lose weight or not. And I think that, well, maybe Vivek, you can tell us a little bit about how do you help patients target a healthy weight if they're, a little bit heavier than they'd like to be?
This is a question that I get pretty much on a daily basis. So I agree with Seema, and I second what she said. I will have different patients coming in with different goals. And we always have to tailor make the goal for the patient. And if there's a patient that happens to be, let's say, 50 or 60 pounds over what their ideal would be, I don't personally recommend that they lose all of that weight very quickly because it's unsustainable. And I think it puts a lot of pressure on the patient, and mostly they may not be able to achieve it and they feel disheartened, and it becomes a cycle of not being able to proceed to a healthy lifestyle. So the first thing I would say is that I look at the patient as an individual and see what goals would they be able to accomplish. I think that there is no right number. We talk a lot in medicine, in our internal medicine, about body mass index, which is basically a formulation that we do about height and weight. And there is a standardization of all body mass index. Everyone should fall into a specific category. I don't quite think that that is appropriate for every patient. And oftentimes patients will ask me, just the other day in my clinic, in my office, the patient was about 50 pounds overweight, and he said to me, "Doc, what's my ideal weight?" And I cringe at that number, at that question, because I know that that patient's ideal body weight is 50 pounds lower. But when I say that number, you see that color drain from the patient's face. And so, as Seema was mentioning, I think it's tailor-made per patient. And what I really like to do is have them look at their starting point, have them assess their level of exercise, their level of diet, keep a food diary, which is very important. And from there, maybe do that for 2-3 weeks. So no changes at that point. And then from there, where do we go to be able to lose a little bit of weight? Something sustainable, something doable. Maybe 5 pounds in 2 months, 5 pounds in 3 months if that's not feasible. And then reevaluate, and again, another 5 pounds. So I've had many patients over the years where they came in, 30, 40 pounds overweight, and through this slow, steady process, lose a little, maintain a little, lose a little, maintain for a while, we've been able to get them down ultimately 20, 30 pounds, which has been very successful.
Both our doctors and our nutrition specialists are saying that we need to individualize plans for each and every person. There's not one program that fits for everybody, not one plan that fits for everyone. Vivek, you mentioned that you talk about not just what people are eating and their goals for weight, but you talk about exercise. Can you explain to us a little bit about the interaction between diet, exercise, and weight loss?
Of course. And those three things are interlinked inextricably. Really, to get good weight loss, diet and exercise have to be a part of that regimen. Patients will sometimes come to me and say, "Doc, I want a quick fix. I want to get bariatric surgery." Or, "Doc, I want a quick fix and I've heard of that medicine, or my brother's taking that medicine. Can I also be on that medicine?" And I often shy away from that as the first line. The first line treatment for weight control certainly has to be a very healthy lifestyle through diet and exercise. I usually recommend at least 30 minutes of exercise 4 times a week, at least, for the patient. And again, as before, it's not a one-size-fits-all. So that's the starting point. So if I have a patient that's really not been very active at all, I may say to them, just start walking for 10 or 15 minutes a day, 3 or 4 times a week, and come follow up with me in a month, 6 weeks. Let's see how that did for you. And if that's too much, we can continue that or lower that for a while. But if you're able to tolerate it, then we gradually ramp up. Similar to what Seema was mentioning about the diet, taking stock of what you're doing and slowly reducing things in a sustainable manner. Similarly for exercise, taking stock of what you're doing and gradually increasing it such that you're able to reach a level that is going to give you weight loss. That's how I would approach it.
Well, Seema, a lot of patients say to me, I only lost 5 pounds. I've been walking all the time, I'm watching my diet, I've been doing this for, 3 months, and I've only lost 5 pounds. What do you think about that?
5 pounds is 5 pounds. And to prove my point, I'm going to bring something very interesting. To a patient who says, "I only lost 5 pounds, I show them this is how much you have lost. And when you show them this, they are able to put things in perspective, that that's not a small work that has gone in, but they have done a profound job in losing 5 pounds. It is heavy. It is uncomfortable when you put it on your abdomen and walk with it, and I make my patients do that. And that gives them a sense of appreciation of their work, that it's not only 5 pounds, but this is what it is. So there is always a beginning to the process. So 1 pound, 2 pounds, 5 pounds slowly get to be 20 pounds or 30 pounds or whatever their goal is. So there is no such thing as a small weight loss. Anything going down in the right direction is what I make them appreciate.
That's quite the model there. And it actually does weigh 5 pounds. So if you come see Seema or one of her colleagues, perhaps you'll get to see that in person. So I hear both of you telling me that weight loss, weight management, being healthy, eating correctly is all a process, that we shouldn't worry about rushing it, and we should appreciate every little bit. More important probably to lose a pound or 2, 5 pounds here and there over a very long time than it is to try to rush out and lose 20 or 30 or 40 pounds quickly. Now, in my family practice, and I'm sure, Vivek, in your internal medicine practice, we do sometimes have patients who have pretty serious medical problems that are negatively impacted by weight and nutrition. And we sometimes have folks who should probably try to lose weight more quickly. So let me ask if you could mention a couple of times, or if can think of some individuals in your practice where you've said, we really need to take some weight off quickly. So what kinds of problems would require that? And then we can talk with you and Seema about how we help people with more rapid weight loss when needed.
I would say that there are definitely instances where we have patients who are quite ill or who have medical conditions that require a more rapid weight loss. I touched upon it a little bit earlier in terms of some of the chronic conditions, such as diabetes. This is one of the scourges of our modern day world, where we have availability of all these big, sodas and, portion sizes this big for a person that's much smaller. I would say that a person that has, for example, uncontrolled diabetes would benefit tremendously from losing weight, because weight loss can do even more for them than even all the medicines in the world, oftentimes. Another person that I would consider would be high risk and would need to lose weight relatively quickly would be an uncontrolled hypertensive patient, a person that has blood pressure elevations that are not being easily controlled with medications. These are just some examples of patients who I feel would be in need for more rapid weight loss than the remainder of the population.
Part of why I asked Dr. Jain about that question is that so many of my patients come in and they want to lose 10 pounds or 20 pounds quickly. Or, their goal may be, I have a wedding to go to. But for the most part, unless you have more serious illness like uncontrolled diabetes or uncontrolled hypertension, there's no great need to lose weight quickly. Now, you mentioned portion size as a big part of why we are challenged with weight loss. And I know, Seema, that you brought some other great examples of what patients can change or perhaps should change to help with controlling portion size to help lose weight.
That's right. Portion distortion is such a common thing these days. We have gone from mini bagels to humongous bagels. And so we have to look at what is the correct portion size. So when patients come in to see me, I usually ask them to come either with their spouses who are the primary cooks in the family or who do the grocery shopping. And I will also ask them sometimes to bring their own utensils to show me what they use as a cup size. So this is what I got once as a cup size versus these are the cups we recommend. So you can just imagine the patient's reaction when I showed her what are the cups that I am referring to versus what are the cups she is using. And so it's amazing when you sit down with them and really visually demonstrate what is it that you're talking about, it starts to open their eyes. Because I don't want patients to go home and continue to do their own behaviors as what they are referring to as portion sizes versus what is really recommended. So it's an eye opener for them. And again, I don't necessarily expect them to change their habits overnight. Again, it's a slow process, but they come along and then they learn to appreciate is how modified portions are working out for them.
So that's especially important when our patients eat outside the home, right? We live in the time of Super Size Me, right? There's a good film perhaps people could watch to learn a little bit about how our modern diet affects our health and our weight, where it's very easy to spend an extra 15 or 20 cents and get an extra 400 or 500 calories of Coca-Cola or some other soft drink. In fact, when I speak to my patients, and I'm sure you both do as well, we like to recommend what we call no sugar sweetened beverages in the diet, which means staying away from colas and other soft drinks. And surprising for many people, it means staying away from juice and sports drinks. Most of those have far more sugar and far less nutrition than is valuable for us. So drinking water or mineral water with a little bit of lemon or lime squeezed in it, or maybe a decaffeinated iced tea or something as a cold beverage. And for people who perhaps need it, milk or soy milk without too much sugar in it would be a good choice for a beverage with a meal.
Mm-hmm. Yes, absolutely. And again, going back to the portion sizes, I want to also share what used to be a glass size, 8 ounces. These are almost ancient now to find. And so people are using big glasses, big cups to even drink juices and milk. So how many calories are we adding per day just through beverages which totally go unaccounted for? So again, this is an education, an eye-opening education for them to understand is even if milk is a healthy beverage, is how much should you drink? Another thing that I want to share with you is I'm from India originally. So when I talk to my Asian patients and Indian patients, I like to show them how much rice can they have as a healthy portion of rice. And when I show them this rice has about 45 grams of carbohydrate, which is usually a budget for their dinner or lunch, they don't believe it. Because typically in our culture, we eat 3, 4, 5 times of rice per meal. So again, this is an education, it's a slow process, and going from 4 to 5 cups of rice to coming to only this much of rice is a very slow process. However, I also teach them that when I'm cutting down on something, I need to add something to make them feel more satisfied. And to make those choices with vegetables, fruits, beans is what they can tolerate and they can enjoy.
Seema, before you put that away, actually, if I may, I'd like to point out to our viewers that this is the right size cup for rice, but also if you're eating other grains or other foods made from grains, so noodles, pasta, and other grains that we might eat, such as kasha or barley or quinoa, or couscous is a pasta, but many people think of it as a grain. All of those, this is an appropriate size for how much carbohydrate we should have in a serving at a meal. And one other thing I like to mention to my patients is, this is your starch, this is your carbs for the meal. You don't get to have a bowl of noodles this size and then, 3 or 4 slices of garlic bread as well. So I'd like to recommend a choice of either grains or breads. But they're both made from grain. So we've talked a little bit about portion size, and Dr. Jain talked about making sure exercise is part of a healthy diet, a healthy lifestyle. We talked some about who needs to have rapid weight loss. I'd like to come back to some other diet and nutrition issues that I hear about or patients ask me about. So Vivek, do our patients need to be taking multivitamins or other supplements? And are there medicines or pills over the counter or otherwise that they can take to help with weight loss?
Vitamins. We get this question all the time, and it seems like the data seems to change sometimes from time to time as to what people should do with vitamins. Earlier, there was a thought that multivitamins would be a benefit, and if you look at it A through Z, it sounds like, hey, I've got everything in as much as I need. But studies were done which actually looked at vitamins and are they actually helping us in any way? And studies have actually shown that just as a general supplement, multivitamins actually did not give any mortality or overall lifespan benefit to patients. So when patients ask me now about multivitamins, doc, should I take a multivitamin A, B, or C? I often tell them, I think that if you would like to do it, you certainly can. Medically speaking, I don't think that it would be necessarily beneficial for you. That being said, of course, there are certain vitamins that are very essential, and again, it depends patient to patient as to who needs what. One thing that we've been seeing over the last, I would say, 5 to 10 years, a lot more of, is vitamin D deficiency. And so if I find that a patient is vitamin D deficient, certainly adding vitamin D to their diet can be very beneficial for them. Many patients have told me after starting and getting vitamin D and getting their vitamin D level higher that they've had tremendous improvement in their overall sense of well-being. In addition, for example, iron is another mineral that can be lacking in certain patients, especially young women. Menstruating women can have low iron counts. Iron deficiency anemia is the technical term for it. When I find that a person is iron deficient, certainly iron can boost up energy and boost up their blood counts. So there are certain situations that do warrant specific vitamins, but I hesitate to say as a general rule that multivitamins are beneficial health-wise.
And Seema, Dr. Jain didn't mention calcium, but I'm sure that you talk with patients, some patients who need extra calcium in their diet. Are there certain people who need more calcium?
Definitely. I think women over 40 should start taking calcium about 1,000 milligrams a day. I also see a lot of bariatric patients, and we monitor their biomarkers, especially calcium, PTH, and vitamin D levels, and they normally take about 1,000 to 1,500 to 2,000 milligrams of calcium every day. Also depends on what choice of calcium you're taking. So for general population, calcium carbonate, which is a commonly found on shelf, is fine, but typically bariatric patients benefit from taking a chewable form or liquid form of calcium, and again, calcium citrate is more absorbable without the acids in your stomach. So it is again case specific, so I don't make general recommendations, but if a patient has had a bariatric surgery, then definitely they need more of the calcium citrate in a chewable or liquid form. Taking calcium is a good idea. It also, and taking it with vitamin D is also very helpful because it helps it absorb better. But also there are dietary sources of calcium such as dairy products and low-fat cottage cheese. You can take Greek yogurt, which is readily available and easily available these days. But these are great sources of protein as well as calcium. People can drink milk. And again, choice is skim milk, 1% milk, 2% milk. They can have those in moderation. One serving of a milk product usually gives about 300 milligrams of calcium, so that's a lot of calcium. So if you are taking supplements, you also want to take a look at how much you are taking from your diet and adjust your calcium supplements accordingly.
I mentioned calcium mostly as we think about it for bone strength, and as Seema mentioned, as we get older, we have a little bit of greater need for calcium because of slowly declining bone strength, which is most noticeable in women in middle age and after menopause. We didn't talk about medicine yet, but let's talk not just about how pills may or may not help us with weight loss, but also other things we have here at the Palo Alto Medical Foundation to help individuals with weight management. We've talked quite a bit about how Seema and her team help people learn about nutrition and set goals, but we do also have some classes and programs here at the clinic that can be helpful. Let's go back to medicine again. So, Vivek, do you prescribe medicines to help people lose weight? Or recommend non-prescription ones?
Yeah, absolutely. Great questions. And again, another one that I get asked by my patients quite frequently. In a patient that's wanting to lose weight rapidly, that is the patient that usually comes in and says, Doc, I really want to be taking a medicine. Either that, or a patient that's tried a lot of dieting, tried a lot of exercising, and they're just not getting to that goal that we talked about, then they feel like maybe the medicine, it might be a better alternative. There are a few medicines that are available to help people lose weight. I caution patients that relying on a medicine to help lose weight is not a good idea. These medicines are not long-term solutions for weight loss. However, I think that in certain situations, medicines can be very effective at stimulating, spurring, or initiating weight loss, and then the patient takes it from there in terms of their own lifestyle changes. So the answer to your question, Stuart, is yes, I do prescribe medicines for weight loss, not very readily, not very frequently, but in a select population that I think would really benefit from them. I've had several patients that actually have benefited from just a month or two of medicine to get them over the initial hump of getting that weight down, and then they take it from there on their own. Yeah.
And I think the key word in my practice that you're mentioning is selective.
Right.
We have to be careful because some of the medicines, particularly non-prescription medicines that patients might use for weight loss, can have negative side effects if they have other medical illness.
Certainly.
Let's move on to programs here at the Palo Alto Medical Foundation that we recommend to our patients to help them with further weight management and healthy nutrition besides just what they hear from their doctor or at a single visit with a dietitian.
I really want to compliment Dr. Jain on believing that medicine is not his first choice of treatment for obesity or overweight. And we are very fortunate at Palo Alto Medical Foundation that all of our physicians really believe in diet and exercise and sending patients, giving them an opportunity to go see a dietitian first. And if that doesn't work, then the next level of option is medicine. So that is really very refreshing to have with us. We have various programs at Palo Alto Medical Foundation. We certainly do have dietitians who do individual counseling for even marginally overweight to severe obesity. We have group classes as in New Way of Life classes at our Santa Cruz locations, Palo Alto locations, and Mountain View locations. We have HMR, which is a Health Management Resources Program. It is for people who can buy foods and be monitored by physicians and counselors. So it's a very structured program for them. We also have a very robust bariatric program. We have 5 surgeons who do bariatric surgeries. We offer bariatric orientations to educate our patients because it is a very profound and a drastic step, and our physicians support that part of our weight loss program as well. However, we feel that it's our responsibility to educate people, to let them know what they are getting into. It is a commitment. It's not an easy way out as people think, and it's a lot of work and a lot of commitment. So we have various choices from individual counseling to group classes to HMR, which is a very structured program, and it works very well, to medicines to bariatric surgery.
And just for our listeners who may not understand the term bariatric, most people think of that as weight loss surgery, stomach bypass, stomach stapling, stomach banding. I can't say that our bariatric surgeons do all of those different procedures, but they would certainly work with an individual patient to decide if surgery is appropriate, which procedure is the best for that individual. But that's what bariatric surgery is. So thank you, Seema, for outlining the range of programs we have here at the Palo Alto Medical Foundation. One thing that I don't believe is something you and your dietitians work on is there is a program through the clinic called weight maintenance, and it's mostly for our patients who do the HMR program, but I believe it's open to any patient referred by a physician who needs help learning how to eat properly again. So many of our patients do go on a diet, or they do a program like HMR, or they have bariatric surgery, and they need help learning, how do I eat properly to keep the weight off? And many of our HMR patients do exceedingly well when they join the weight maintenance program, which can last up to a couple of years. It's voluntary, of course, but there has been research that shows that when we are able to maintain our weight at a steady level for a couple of years, that retrains our body to believe that that is our new proper weight, as opposed to trying to gain back all the weight we just lost from starving ourselves to death. Well, that's an oversimplification of some of the science, but very important that people try hard to maintain their weight for quite some time. If I've tried some of the things we talked about at home, things that I saw the TV program, and now I'm working on my diet, I'm working on exercise, I'm doing pretty well on my own, but I need help. I think I'd like to get some help through our Palo Alto Medical Foundation. Who should I call first? Where should I start?
First of all, I'm very happy to see that you're trying to lose weight and being very active about your lifestyle and dieting. If someone has already done that, I love patients like that because they're already trying on their own. They're self-motivated. The next step would be to contact your primary care provider, someone like me, an internist or a family practitioner, because we have a medical background that can actually look at your individual case. As we were talking about earlier, Seema and you, about how every case is different. There is no one size fits all when we're thinking about health, when we're thinking about exercise level, dietary changes. So involve your primary care provider, and they will look at your unique profile, your unique medical profile, to determine what the best scenario would be for you. Is it that you need to lose rapidly, like we were talking about earlier? Do you have one of those medical conditions that warrant that you lose weight more rapidly? Or is a little bit of weight loss going to get you to the level that you need to in your health? So that's where I would start with. At that visit, we will take your whole inventory about your exercise level now, what your goals are, your diet now. As I was mentioning earlier, a food diary would be an excellent thing to keep prior to seeing your primary care provider, because that gives us a lot of data of what you're already doing and what improvements can be made, and ultimately your weight loss goals. So I would say the primary care provider is the first person that you would go to.
And then if you need more help, the primary care doctor can make referrals.
Certainly, to Seema, for example.
Thank you. Yes, and we heavily depend on the primary care physician's involvement in the patient care. They guide us in what needs to be done nutritionally. And when the patients come to us, we have their lab work to see if they have been diagnosed with any thyroid malfunction, if that needs to be kind of addressed with nutrition, if they have any deficiencies at the same time when they're battling their weight problems. So we look at the entire picture and offer recommendations based on that. Not only do we correct their diet, but we also like to look at their cultural background, at what makes them happy with the food, because dieting and exercise is a huge change in a person's life, and our intention is not to change their lifestyle overnight, but to empower them with the proper information that begins in their kitchen, and then we take it outdoors in form of an exercise. And it works very well when we understand their background, when we understand what they need to do, where they are, what is their starting point, and then start the process slowly. It's not a one visit and solution. So we usually tend to follow up our patients periodically, and patients like that kind of connection. Once they make that connection, they begin to trust you, they begin to comply with your recommendations, and begin to listen to what you are asking of them.
Well, I'd like to thank Seema for that wonderful summary of how we here at the Palo Alto Medical Foundation would like to help you, our viewers, and our patients work on healthy nutrition, lifestyle, and weight management if needed. And I think, Seema, you're going to be the next host, actually. You did a great job there. And thanks to you too, Vivek, Dr. Vivek Jain from our Department of Internal Medicine. Hopefully you, our viewers, have heard that at the Palo Alto Medical Foundation, working to help you individually achieve a healthy lifestyle, learn about diet, and manage your weight if necessary, is a very important part of helping you be healthy overall and prevent medical illness in your future. So thanks for joining us tonight on Health Connections, KCAT Television. From the Palo Alto Medical Foundation, Los Gatos Center, I'm Dr. Stuart Menakar.